So, Mr. Williams, we've had your checkup done, and I've looked at the lab information that your primary care physician sent, and the electrocardiogram that's raising some concern. And from my standpoint, you're in excellent shape, physical condition, and your risk factors are very low. The changes in the electrocardiogram are quite typical for younger people that are exercising a lot, and in particular, in the African American community, they're even more common. So from my standpoint, that's all you need. You don't need any further testing at this point. So what are your concerns about that? I know you're working out. I guess you have some concerns about what's going on when you exercise.
Yeah. Well, my primary care physician decided to give me an EKG. I'm 39, about to turn 40, and she says it's something that she does for anybody who's about to turn 40, and she saw this spike on the EKG, and it got her a little alarmed, so she put me on a baby aspirin, and she wrote me a referral to come see you. I work out pretty intense 4 or 5 days a week, and I run a 5K every month, and in the first mile of my 5K, I try to do a 7-minute mile, just to really get my heart rate up and just kind of compete against myself. And I'm just nervous that something could go wrong if I don't, be a little preemptive here.
Well, we've been looking at cardiograms and athletes and younger, and I'll call you younger, you're under 50 at least, in people who work out a lot. And we do find that there are ECG changes that are basically considered to be within the range of acceptable normal for somebody that's younger who is exercising a lot. So that finding has been well studied throughout the world, actually, from the standpoint of large populations and clinical studies, and it does not impart any increased risk for your exercise activities.
Okay.
So again, from that, I would recommend we don't need to do anything else, and I know you have some concerns about that, but I wouldn't recommend that we need to do anything further.
Okay. Well, I'm reading about these older athletes who have problems later in life, and then most recently a college athlete who died of a pre-existing condition that could have been found early. And I'm just a little concerned, and I know my insurance will pay for it, so I'm always of the mindset that more information is better than less. So why not just do it? What's the downside?
Well, first of all, let me say that we have been very interested in screening athletes for sudden death risk during sports, and we have some characteristic findings on the electrocardiogram in people at risk. You do not have any of those findings. So number one, you don't have a high-risk cardiogram, I think, which is reassuring for me, and I think I can comfortably tell you that you don't have to worry about that. The other problem in doing the testing that you don't really need is the problem of finding small abnormalities that provoke another test and then another test. And so we can keep moving forward with tests that don't mean anything, but that put you at risk from the test itself. So I'm inclined to take the cardiogram, your risk factors that we know from your clinical evaluation, and the fact that you're well-conditioned, that you're out running 7-minute miles, as enough evidence that you are not at risk for any serious problems with exercise.
Okay. Is this something I should be concerned about, say, when I turn 45?
Normally we wouldn't worry at least up to into your 50s, and if you're still working out like this and still exercising a lot, and your risk factors all stay excellent, good cholesterol, normal blood pressure, no smoking, and so on, you wouldn't need a stress test even up into your 50s at this point.
Oh, okay. All right. Well, my primary care physician obviously didn't have the information that you have, but in light of everything that you told me, I feel a lot more confident that I'm in good shape and less anxious about it. So if you think that's all I need, then I feel reassured.
Right, and I would recommend that you continue what you're doing, continue your exercise activity. We'll get a note off to your primary care physician to let her know that everything looks good. Okay.
All right, great.
All right.
Great. Well, I appreciate your time. I think I'm good.
Good, and good luck in your races.
All right.